Hi, I'm Ali. I'm one of the physios from treatmyachilles.com. This is the first in a series of videos doing a deeper dive into Sever's disease, or Sever's is the same term as pain in the heel with some irritation around the bottom of where that Achilles attaches into the heel bone, typically found in children. And the average age is between 9 to 15 for this sort of condition. So if your child is complaining of pain in the bottom of their heel or around their Achilles after PE or sports, then this is the video series for you. This first series is going to first video is going to be looking into what is Sever's disease and what causes it. We are treatmyachilles.com, which is an online physiotherapy practice treating all things related to Achilles injuries. So if you would like to find out a little bit more about our service or would like to book an appointment, please have a look at the information below. So let's start with, what is Sever's disease? Well, I think it's a terrible term, to be perfectly honest, because the word disease rings all sorts of different alarm bells, and it's not really true, and it's a poor choice of words when we're looking at this diagnosis. So if we ignore the word disease and think about what is Sever's, Sever's is talking about a traction apophysitis. So it's a type of traction apophysitis. As we grow and as we have different changes in the length of our bones and our soft tissue, they can cause pulling or traction onto the areas where tendons attach in the body, and depending on how old we are, depend on which areas are more likely to be a problem. So first of all, the younger age group is more likely to get things lower down in the body, so around the heel and the feet, as that's the point where our growth plates start to fuse, and we'll come on to what that means in a moment, and they fuse earlier. And then as we move up the body towards our knees or our hips and our pelvis, they become the later time that things start to fuse. So people tend to get different traction apophysitis, or more likely to get them depending on their age. So what do I mean by this? So traction, exactly what you would think it would be. Traction is pulling, and the pulling forces where the tendon attaches onto a bone. Apophysis, it means a growth plate. So everywhere in our body we have our bones, and our bones have growth plates within them. This is how they change in size during childhood and as we grow. So babies are born with about 300 bones, and adults then later have 206 bones. And that's because those bones have fused together as our skeleton matures. So the growth plate we're talking about for Sever's is in the calcaneus bone, and that calcaneus bone is the heel bone. Your Achilles tendon, which we can see in our picture, is made up of the calf muscles which turn into the Achilles, which attach at the bottom of that heel bone where that growth plate is. So that growth plate becomes more noticeable around the age of 7 to 9, and it tends to fuse in our mid-teens, so around 13, 14, 15 years old. So it can happen in younger children if they're going through growth spurts quite quickly. It can happen later, mid-teens, if we are growing at that point. If you are over 18 and you are or an adult and you are thinking, have I got Sever's disease? It is highly unlikely, as this is related to growth plates, and your growth plates will have fused at this point. You are more likely to then have Achilles tendinopathy or tendinitis. So again, if you are unsure, please have a look at the links to the article below. So where that Achilles tendon comes and attaches, if we were to grow, our bones grow at different speeds to the rest of our soft tissue. So the soft tissue we're talking about in this instance is muscles and tendons. So if our bones are growing and our muscles haven't quite caught up yet, there is a bit of tension in that area, and where that tension is, it pulls or tractions on the bottom of that apophysis. So then we have our traction, the pulling, the apophysis, the growth plate, and itis, meaning inflammation. So the inflammation is irritation around where that Achilles tendon inserts into the growth plate itself. It may irritate around that Achilles tendon too. So how does this cause traction, and why is that affecting children that are more likely to be having pain after sport or PE, as we said in the introduction? Well, our Achilles and our calf muscles are our plantar flexors of our foot. Well, what does that mean? That means they help us raise onto our tiptoes. So when our calf muscle contracts, we raise onto our tiptoes, or we point our foot down if we're not in a standing position. So boat movement is super important in anything related to walking, running, jumping, hopping. So basically sports. If we were out to do our sports and we play on a very regular basis, or we train multiple times a day, we might do the same repetitive sport, or we might be doing lots of different sports. So if you think about children aged between 7 to 15, that's quite a sporty time. So those children may be doing PE at school, they may be walking to and from school, they may be doing after school activities, playing sports for a school team, and then after school clubs, and potentially playing for those after school clubs in matches or training multiple times a week. So if that's the case, that contraction, that movement of pushing us up onto our tiptoe, is when we're contracting our calf, which is where the Achilles attaches to that calcaneus. So it's irritated, it's pulling, and that's then what causes this issue. Now remember, this isn't a bad thing. We should be doing sport. We should be pushing off on our tiptoes. We should be running, and that's okay. We're talking about this injury being related to the time that we're also growing. So it's overuse, using that muscle at the same time that that growth plate is active and we're shooting up in height. Our bones are growing at different times to our muscles, and because of that, and because of maybe less rest in between activity during this active period of life, we then can, not in every case, so not everybody gets severs, but this is why we would get heel pain at this age group. It would irritate where that inserts at the bottom. So the good news is that this is self-limiting. So we do grow, we do stop growing, and those growth plates fuse, as we said. It's confused a little bit later in life as we move up the skeleton. So this growth plate fuses at the latest around that sort of age of 15. So therefore it can stop causing this problem, and there's no indication that you would then have a problem later in life. You may have something where this reoccurs, so your child may feel like this is settled and it's eased, and then they can get back into sports and activities, and then it can reoccur again, especially if they're still in that growth pattern or in that period of time where that growth plate is still active. So if that's the case, again, we're going to cover that reoccurrence and how to manage that in our treatment section of the series of videos. So if you're wondering whether your child has severs, what you're looking at is a selection of different factors. So it is rare in sedentary children because we need that traction, that contraction of that muscle. It's also rare in children that aren't currently growing. So you would be wanting to ask yourself, is my child complaining of pain or symptoms at the end of sporting activities or after they've finished? Or indeed the next day when they wake up and it feels a bit stiff or it feels a bit tight? How are they doing quite a lot of sport and activity on quite a few days of the week? And are they suddenly shooting up in height and going through a growth spurt? Other signs of growth spurts, other than just changes in height, can be teeth falling out. It can be because you're changing in the shape of your jaw. It can be changing sizes of shoes quite regularly. It could also be a lack of coordination or clumsiness because, again, our soft tissue, so our muscles and nerves and our ligaments and all of the things that are not bones, grow at a different rate to our bones. So we lose that coordination temporarily for a short period of time until it all sorts of catches up with itself. So we've spoken about muscles also causing this traction. We've also just touched on other types of soft tissues that grow at different speeds. Well, we have nerves in our body. Now, our nerves are part of a big system. So our system, if we think about that being our central nervous system, that's our brain and our spinal cord. Imagine that to be a trunk of a tree. And then all of the nerves that come out of our spine at all of the different levels, from our neck all the way down to our tailbone, they imagine those to be branches of those trees. Those branches then converge. So the ones coming out of your lower back, they converge and they turn into the nerves that run down our legs. So now think again of those being big branches, and then those twigs come off those branches into all of the structures as it goes past. So if we're, again, getting tight calves there because we're getting that traction, feeling that growth spurt happening, we also may have what's called neural tension. Now, you can have a little go at a test to test neural tension, which I'll demonstrate in a moment. And if this is positive, then there are some things to do for this. So you would be looking to try and calm down some activity, treat the traction part, and that might not just be treating the muscles, that also might be treating the nerves, which we'll come on to in some further videos in a bit more detail. So our simple nerve glide test would be in a seated position. You would have their hands gently behind their backs, and they come into a slumped position as far as they feel comfortable to go. And they would do this themselves. You don't need to help. And then tuck their chin onto their chest. In that position, you'll have a go with their better leg. Sometimes with Severs, it's both legs because we're growing at the same time on both feet. Other times it's one or the other. So you would straighten their better leg and pull their toes back towards them and then relax again. And you're looking for, what does that feel like? Really, really normal to feel something, really normal to feel a bit of a stretch. Some people might not feel anything at all. So that's why it's important to check. See what they're feeling. Does it replicate any tension or tightness, particularly in that calf or towards the heel? If you were then to look forwards and repeat that movement, does that symptom change? If it changes, we know that something connecting the head to the leg is involved in that sensation, and therefore we're thinking there is some neural tension here. You would then do the same on the other leg, and now you're looking for the same. Is it different with the head down to the head up? Or is it different on a bad leg compared to a good leg? You would only go as far as you feel any tension or any symptoms. We do not overstretch in this position at all. It's not very pleasant if that's the case. So you would come down, go to the point of where you feel that tension or tightness or pain, and come back off. You do not push into the pain whatsoever. The only thing I would say, if you are experiencing this and your child is having these problems in their heel, you're better off seeing a clinician face-to-face who can perform these tests, or online where we can talk you through these tests in a different manner so we can assess what is going on. A further thing that we would look for when we are assessing somebody, which we can do again online, you are looking to have it at what position people's feet are in. So if you have a good arch and it's pretty high and that arch stays quite high, that can be called a supinated foot. And if you have a lower arch or an arch that's more flattened, that can be called a pronated foot. They're quite common, both of those things. Pronated ones slightly more common than supinated. And you can have a mixture. Some people are super high, some people can be super flat. We don't know enough with the research about how this relates to Sever's disease. There's not a lot of evidence base out there, but it makes sense when we look at pronated feet or the more flatter arch type that there could be a relationship with this. So this is something we would be assessing. Now, why that's the case is when we go into our toe off movement, that push off movement, we go into an extended toe position. So when we're onto our tiptoes, our toes are extended. This in turn tightens all the muscles in the sole of our foot, and that's called a windlass mechanism. If we have a more pronated foot, that windlass mechanism isn't as effective, And that in turn can cause a bit more of a traction sensation on the back of the heel at the Achilles, typically more the inside part than the outside part. So although there isn't loads of evidence base out there, it's worth looking at this with your child to see whether there's anything we can do to help address that. There again can be some simple exercises, to be tape, could be different orthotics, and again these are discussed a little bit more in these series of videos. Sometimes there can be a link with plantar fasciitis or foot pain, again less common in children, so where they're feeling their pain is important. Plantar fascia tends to be under the heel pad at the bottom of the heel, or into where the heel is about to meet the rest of the foot, and it tends to be in a slightly different position, and again can relate to that pushing off activity and the more pronated foot that we've spoken about with our windlass mechanism. So again, something that would need to be assessed by a clinician properly. We also would be looking for an assessment at that time to look to see whether we're ruling out any other causes to this. But Severs itself tends to settle very quickly. There can be some cases where children have managed to push through very high levels of pain for a very long period of time, and that can cause some issues with the growth plate itself. But these are very rare and not something that commonly happens, but it is important to get your child assessed to make sure that this is not happening with them. Is Severs something that can be genetic? Not really, no. There isn't like a test for it, or if your dad had it or your mum had it or your gran had it, you're more likely to get it. No. But if you are from a tall family and that you are therefore likely to grow more, you may be more predisposed to having Severs than somebody that is less likely to grow as tall, but that's not always the case. So nothing genetic, nothing to worry about in that sense. So in summary, we know that Severs is not a disease. It's not something that you can catch. It's not something that you can pass on. It's not something that's going to be a problem lifelong. It is a traction apophysitis, so pulling and forces going through where the Achilles tendon attaches into the calcaneal apophysis or the growth plate at the bottom of the heel. And that traction tends to be related to lots and lots of activity around the time that we're growing, and during those growth spurts we have our bones growing at different times to our soft tissue, which include our muscles and our nerves. So if you can, the good news is manage it really well, and we will go on to detail how you can do that in the next few videos. And the other good news is that this is limiting, self-limiting. It does go away, and it doesn't mean you're going to have problems later in life. So finally, if your child is displaying any symptoms or you feel like these causes we've discussed ring true to you and their symptoms and problems that they're getting, please reach out to a practitioner and clinician to get advice on what to do for your specific child. This lends itself very nicely to be able to be done online or in person, and at Treat My Achilles we can do all of the tests that we've just gone through. We also offer a tailor-made program where you're looking at how you can modify that child's activities or what they're doing in their sports and what's expected of them and how we can change that. What they can do specifically for themselves to look at their muscles and their soft tissue and how they're using their bodies, and we can assess using that slump test and looking at foot position as to see what else may be necessary for your child.